Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
In many cultures, childless women still suffer discrimination and stigma. An inability to have a child or to become pregnant can result in being greatly isolated, disinherited, or assaulted. This often results in divorce or physical and psychological violence. Jackie Dewey founded Before the Baby Initiative on her 10th marriage anniversary last year. Dewey, while speaking to NTV on the phone, says it has been quite a journey dealing with infertility.
A happy marriage, by the way, that we didn't have a child, and it seems to have bothered everyone around us. People that know you, people that don't know you will always ask such questions. Actually, they say, oh, the woman doesn't produce.
She says her supportive family and spouse have helped her fight off critics.
Children are good, but they are a gift from God. But what if they do not come? Does that mean you're not useful to your community? Does that mean you're not useful to the society? Are you not able to serve in other capacities? So people need to know that you're more than a child.
More than a baby and more than a mother, just like the Merck Foundation slogan goes, for a campaign to raise awareness about infertility. The foundation has designed books with information for young people about the health problem. Dr. Rasha Kelej is the Chief Executive Officer of the Merck Foundation.
We cannot have this educated in the school unless if it is approved by the Minister of Education. But we have a storybook. It can be distributed on girls. It can be online, to be read online, which is called David's Story. It's speaking about how to raise awareness about infertility, encourage boys from young age to support their wife, respect their wives, future wives, of course, and to love, emphasize the family as family values, strong family values of love and respect to each other, whether they have children or not.
Dr. Rasha explains why they are now focusing on children.
And they are easy to shape because their characters are not yet formed completely. So it's very easy to shape. It's very difficult to change someone who's older and stabilize in his beliefs and values, which is not impossible, but it's more difficult.
Dr. Ganzaga Anderbati, a gynecologist from Bethany Women's and Family Hospital, says parents or caretakers should be critical of the growth stages of their children, especially at the puberty stage.
It is a very critical age during which the reproductive system is maturing very rapidly at the transition from childhood to adulthood. And it must occur at a certain age, for example, between the ages of 10 to 12 years. It must occur within that age. If it is delayed, we need to know why it is delaying, and if it is a problem, that problem should be sorted out.
He says there is increased sexual drive at this stage, and children should be protected from temptation of bad sexual practices,
which could jeopardize their ability to bear children in future. They could get infections out of that, of the reproductive system, get blockage of tubes, get infections which go into their testicles and cause damages there. And these are very early stage interventions which must be looked at.
Dr. Anderbati says young people should also be warned about preventable external causes of infertility, sometimes including abuse of drugs.
A lot of the problems we get, for example, result from infections. Infections, especially when infections of the reproductive system, sexually transmitted infections, gonorrhea, we still see those. Syphilis, we still see those, and some of the infections are viral infections. They go direct into the sperm producing organs or egg producing organs, the ovaries. So those external factors are still there. Also drugs. These illicit medications which people use, drugs which are abused for excitements, recreational drugs, they do affect the functioning and development of the reproductive system. Very severely they do, yes. Even alcohol, all those things, yes, they do affect. And some cultural practices, for example, in some cultures they still do female genital mutilation, and those affect the reproductive potential of these children.
Modern medicine has now devised means for treating complications that cause infertility.
The first thing is to identify where is the problem. Now, if we identify the problem, some of the problems have solutions which are simple. For example, if it's a problem of ovulation, the eggs are there and the eggs are not being released. We have medications you can give that the woman can ovulate and then they meet and they get a baby. Yes. If the problem is in the tube, for example, we have to grade the problem. Is it a mild problem? If it's a mild problem, we can correct the tube problems, either through some simple surgical intervention, or sometimes we increase the number of eggs by stimulation and then they can get a pregnancy. But if the tube problem is severe, then they have to go for a higher technology. They have to receive a higher technology, what we call IVF, which is a treatment which helps you to bypass the function of the tube. You fertilize outside and then put in the embryo after fertilization. If the problem is with the sperms, it's a mild problem, you could correct it with some medication.
Uganda, however, is still developing a policy to support infertility treatment, especially regarding procedures like in vitro fertilization, IVF, surrogacy, and procedures like sperm and egg donation. This is considered a setback, along with the high charges for the procedures. Infertility remains a major challenge in the country, with an estimated 5 million people facing the problem. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.